Hey girl gang, it's Dr. Joy here and you're watching Delivering Joy MD TV. So today I'm talking about nausea and vomiting of pregnancy. This is part of our Super Mama Sunday series and it is one of the most common conditions that pregnant women experience. So I'm going to be talking to you about some tricks, hacks, and warning signs today that you need to know about. So make sure you keep watching. All right, girl gang. So when we're thinking about nausea and vomiting of pregnancy, we actually know that 50 to 80% of women are going to experience nausea and or vomiting during their pregnancy. So this is kind of a very common thing. A lot of people refer to it as morning sickness, although it can occur at any time throughout the day. There have been lots of studies about this because we're always really interested in what actually causes this condition. So the most current research has actually tried to stratify mild, moderate, and severe nausea and vomiting of pregnancy. And so we think that if you are feeling nauseated for 1 to 5 hours out of the day, that's more mild to moderate. If you're feeling nauseated more than 6 hours out of the day, that's more severe nausea. Likewise, if you're actually throwing up, if you're actually vomiting up to 2 times daily, that's considered more mild to moderate. But if you are vomiting more than 5 times daily, that can be considered severe. So these are things that just kind of help us quantify. So when you go to see your OB or when you're coming here to see me, that's something that's very helpful for me to know. How many times a day are you vomiting? About how many hours a day are you feeling nauseated? So that we can kind of categorize your particular nausea or vomiting and make sure that you're getting the right treatment. So a really interesting study came out called the PUKE study, which I think is amazing. I love how they came up with that terminology. But PUKE actually stands for Pregnancy Unique Quantification of emesis. This is a really neat piece of research because it actually quantifies how women feel about their condition. So one of the things we know about nausea and vomiting in pregnancy is that it can make that first trimester or even subsequent trimesters really suck. So a lot of women really have a change in their quality of life when they're having a lot of nausea and vomiting. And so it's really important for us to kind of get an idea about that. I'm going to post the PUKE scale right here so you can kind of take a look at it. Down in the description bar below, you'll find a link to the PUKE score calculator so you can see what your PUKE score is. So basically what we're looking at with that is how many times you're actually vomiting, whether or not you're losing weight, if you are feeling like the quality of your life is poorer because you're always so nauseated or throwing up or unable to keep down food. So we're using that PUKE score to kind of determine how severe your nausea and vomiting may be. So about 3% of women are going to experience severe nausea and vomiting during their pregnancy. This is a condition that we refer to as Hyperemesis gravidarum, or basically a lot of throwing up when you're pregnant is what that means in regular everyday terms. With Hyperemesis gravidarum, the severe form of nausea and vomiting, we can see several kind of clues that you may be entering that severe phase. One is if you've lost more than 5% of your body weight, if you have electrolyte imbalances like your sodium, potassium, magnesium, calcium, if those are all out of whack, that can be a sign that you have severe nausea and vomiting of pregnancy or hyperemesis. In addition, we can see kind of like real-time signs that your body is going through starvation. And the easiest way to tell this is by measuring what's called ketones in your urine. When we see ketones in urine, we know that you're either very dehydrated or that your body is now burning ketones for fuel instead of sugar or glucose, which is what our body normally likes to burn. Along with seeing ketones in the urine, we can also see abnormal thyroid tests, abnormal liver tests. So these are all sort of clues that guide us to the idea that you have hyperemesis, gravidarum, or severe nausea, vomiting in pregnancy. And to be quite honest with you, I mean, you can usually look at these moms and tell that they're pretty sick and that they feel pretty bad. So whenever we identify a mom who does have severe nausea and vomiting in pregnancy, we want to go ahead and design a treatment plan. Usually that is going to really involve some prescription medications, maybe IV fluids. There are certain drips that we can use to try to help replace your vitamin stores. And in some very rare, severe cases, we need to put you on what's called total parenteral nutrition, or TPN, where we're giving you a nutrition via IV, but that's very rare that happens. So the one thing that you always want to consider is that lots of nausea and vomiting may not be pregnancy all by itself. Other conditions can happen in pregnancy just like they can happen when you're not pregnant. So if your nausea and vomiting is severe and it's not really going away with the basic treatment regimens that we usually use, like Zofran or Phenergan or Reglan or IV fluids or IV vitamin treatment, you may really want to talk to your obstetrician about investigating for some of these other causes that can occur. These could be things like gallbladder disease. Gallstones is a huge cause of nausea and vomiting during pregnancy. Appendicitis can also occur during pregnancy. Pancreatitis, like when your pancreas is inflamed, is another thing that we can see. Severe urinary tract infections or even kidney stones can also cause a lot of nausea and vomiting. And of course, food poisoning and stomach viruses occur as well. So if you're not really getting great relief with prescription anti-nausea medications for severe nausea and vomiting, it's time to investigate. If you're one of the majority of pregnant women who's having nausea and vomiting during her pregnancy, you're not going to experience these really severe complications. What you really want to focus in on is how to feel better fast. So I always start with conservative measures first because I really like to use natural remedies as much as possible during pregnancy, especially in early pregnancy, because sometimes when you have severe nausea and vomiting, prescription medications or even being in the hospital do become necessary. But here are some easy routes that you can take at home to try to ease your nausea and vomiting. Vitamin B6 is fantastic for that, and your OB can prescribe it or you can pick it up over the counter. You do 25 milligrams with breakfast, lunch, and dinner, and that really helps cut down on nausea. In addition, doxylamine, or the sleep medication called Unisom, can be very helpful with nausea and vomiting. So I always encourage my patients to keep some Unisom and vitamin B6 on hand. This is also manufactured as the medication Diclegis that you see us try sometimes for nausea and vomiting. C-bands that you wear actually on your wrist can be very helpful. I've had lots of patients who've tried acupuncture if they're having a hard time with nausea and vomiting. And then, of course, the BRAT diet. So the BRAT diet stands for bananas, rice, applesauce, and toast. And basically what we're saying with this is we want you to have a really bland diet. No greasy foods, no fatty foods, no really spicy foods. These are all things that can really rev up your nausea and vomiting. In addition, if you're a tomato sauce girl, you may want to avoid those acidic foods like ketchup, tomato sauce, oranges, lemons, and all of that sort of thing. The biggest thing that we really want you to do is to stay well hydrated and make sure that you're eating what you can tolerate. Small, frequent meals tend to work best. So don't try to eat a whole plate of food. Eat something small that you can tolerate, some applesauce, some yogurt, a little bit of oatmeal, something that's nice, soft, and bland, and see if you can keep that down. Most importantly, keeping down fluids is a big deal. So if you like Gatorade, Powerade, Pedialyte, whatever it is that you like that's a sports drink that has electrolytes, try drinking that. Remember, Most pregnant women are going to feel so much better in second trimester, but if you feel like you're having that severe nausea and vomiting that we talked about earlier in this video, make sure you talk to your care providers and make sure that you don't have another condition that might be causing your nausea and vomiting. I hope this video was helpful for you, and if so, give it a thumbs up. If you have questions or concerns that you want to post in the comments, go ahead and post those below. Make sure that you subscribe so that you don't miss a single episode of Delivering Joy MD TV. And I'll catch you next time, girl gang. Peace.